The second major factor, or critical factor for brain health promotion, again, across your lifespan, is physical activity. Now, why is physical activity important for the brain? Remember, every time your heart beats, 25% of the blood coming out of the heartbeat goes right to your brain. So, remaining mobile and physically active becomes critically important for the brain, maybe even more so than for the heart. What does the research tell us about physical activity and its relationship to brain health? What do we know? Number one, we learned from the Journal of the American Medical Association in 2004 that if you walk on a regular basis 3 times a week, you are less likely to develop dementia than those who don't walk at all. Now, that's a medical way of saying what I'm saying to you today, which is that if you walk several times a week, you're going to increase your brain health. All right. People that walk once a week even have a reduced risk of dementia relative to those who don't walk at all. Now, it's very common for me to ask the question, how many steps are you supposed to be walking every day? And as you hear this question, you could probably answer for yourself, and most people respond accurately. We're told 10,000 steps. The interesting thing about that for me is that Americans know that answer, which tells me that we've educated the public about what to do. So how are you going to know how many steps you walk every day? What are you going to do, walk around and keep track of how many steps you're taking? No. You all should have a little pedometer. And a pedometer is a little device you attach to your belt buckle, and it keeps track of how many steps you take every day. Have a little fun with it, you know. Go out and buy somebody that you love a pedometer. You can get them at a local Walmart or store nearby where you live, and a couple of dollars. Really doing something important for somebody you love. The other thing you can do with a pedometer, like I do, I put it on my stand next to my bed at night, and when I wake up in the morning, that's a little device there that reminds me to do what? Walk. And I've had the pleasure of building some brain health programs across the country, and everybody in the corporate structure now has a pedometer. We have some fun with it. We challenge each other. What do you got? Well, I got 4,000. I've got 2,000. I've only got 500. One of the interesting things I've learned is we need to follow the maintenance employees out there, because maintenance men and women walk thousands of steps, if not 15,000 steps a day at their work site. It's kind of fun. They're always on the move. Now, what else do we know from research? You know, dance. Dance itself. Again, the Journal of the American Medical Association. If you dance on a regular basis, and indeed the tango is one of these examples of a dance that has been shown, when done regularly, to reduce the risk of dementia. I know it sounds funny, it sounds odd, but you got to remember we're Americans. We've been seduced into believing if it's not a pill or a vaccine or a syrup or a liquid, it must not be valuable, and that's not true. Okay, that's not true. That's our problem, that we need to change our mindset. So dance also. Think about dance, though. If you weren't from this planet and you were looking at human animals dancing on a dance floor, let's say at a wedding, that's kind of a funny behavior. But interestingly, don't we move our entire body? Unless you've got some kind of funky dance out there you need to share with me, we tend to use both sides of our body. If you pay close attention to these activities, even though the research doesn't talk about this, the activities that tend to promote brain health tend to use both sides of the body. And if you think about your arms, both of them, left and right, and your legs, left and right, those are really just avenues into the brain. Remember, the left side of your body is controlled by the right side of the brain, and vice versa. Haven't we in our country been sort of quietly seduced into using one side of our body? There's some left-handers out there, I know. You could tell with a story to me about how you were left-handed, but early on in your life you were actually scolded for using it. So you had to switch over to the right side. I mean, we've literally gone to the extreme of punishing people not to use a certain side of their body. So we want to use both sides of our body. What I always like to say is an ambidextrous brain is the best brain. All right, so we want to think about that. What else can we do from a physical standpoint? Certainly aerobics and cardiovascular workouts are very, very good. We've already talked about walking. You can think about swimming. You can think about bike riding. The kinds of things that do what? Get your heart beating better, get better blood flow. You know, when I was in grad school a decade ago, we didn't talk about blood flow as being all that important for the brain. For example, you either had a dementia caused by Alzheimer's or a dementia caused by a lot of strokes, called vascular dementia. Well, today, that's all changed. We think blood flow is critical, even to perhaps one of the causing factors to Alzheimer's disease. So we want to make sure that our blood flow is very, very good. That is why physical activity is very important. A couple other research-based activities. Gardening has been shown to reduce the risk of dementia. Knitting has been shown to reduce the risk of dementia. Again, remember, using both sides of the body. Now think about it from the context of the brain. You have a plot of land in front of you, and you're going to plant. You're going to grow your garden, like so many people do. You obviously have to be able to plan, P-L-A-N, into the future, because you're going to grow certain kinds of vegetables. And you're going to have some foresight in terms of how fast the corn will grow relative to the carrots, relative to the lettuce. When you plan, see yourself into the future, that may be the most complicated thing we do. What else is the brain asked to do with gardening? Certainly motor skills, but also visual spatial skill, your ability to appreciate space around you. Again, a very complex skill that develops last as we grow from childhood up. It's one of the parts of the brain that develops last. Very complicated cognitive function. Knitting. I was in New York one time, it's a true story, and giving a talk on the brain. There was a lady knitting in my audience, and I was talking about knitting and sharing the research, and she yelled out like an assertive New Yorker would do, female, and she said, Dr. Nussbaum. I said, yes, ma'am. She said, you're looking at me right now knitting, and you think I'm just doing the same kind of rote procedure. Now, I don't know how to knit, so I answered, yes, you're right, ma'am. I'm guilty of that. She said, the thing you don't understand, young man, is that I am 5 steps ahead of where you see me right now. So I said, thank you. I said, you've just taught me something about knitting I didn't know. Obviously, there's planning involved. Again, one of the most complicated things we do. And you think about both hands being used in the motor skills. And you have to look at activities not as something that you just take for granted, but what is the activity demanding the brain to do? And there you can get the answer in terms of the real neuropsychology and what's being nurtured and nourished in the brain for each activity.